Hello everyone, and welcome back to our channel. Today, we're diving into an important topic that affects millions of people worldwide: myopia, also known as nearsightedness. If you've ever found yourself squinting to see faraway objects or noticed your child struggling to read the board at school, this video is for you. We'll break down what myopia really is, why it happens, the symptoms you should never ignore, and the most effective treatment options, all explained in a clear, doctor-approved way. Make sure you watch until the very end, because I'll also be sharing some powerful tips to protect your vision and slow down myopia progression. Your eyes are precious, and a few minutes of your time today could make a lifetime of difference for your vision. Let's get started. What is myopia? Myopia, or nearsightedness, is a refractive error where the eye's optical system focuses light in front of the retina instead of directly on it. As a result, near objects appear clear, while distant objects elongation of the eyeball, the most common cause. Excessive curvature of the cornea or lens causes excessive bending of light rays, focusing them in front of the retina. Types of myopia. 1. Simple myopia. Usually ranges from 0.5 to 6.0 diopters. Commonly develops in childhood or adolescence. 2. High myopia. Greater than 6.0 diopters. Often hereditary and increases the risk of serious eye complications. 3. Progressive myopia. Vision worsens steadily over several years. May progress until the late 20s or early 30s. 1. Simple myopia. Definition: refractive error, ranging from 0.5 to 6.0 diopters. Characteristics: caused by a slightly elongated eyeball or excessive optical power of the cornea, lens. Onset usually begins in childhood or adolescence, stabilizing around age 20 to 22. 2. High myopia. Definition: greater than 6.0 diopters. Characteristics: significantly elongated eyeball, leading to stretching and thinning of the retina and surrounding tissues. Risks: increased likelihood of retinal detachment, myopic maculopathy, and glaucoma. 3. Progressive myopia. Definition: myopia that worsens continuously, often is greater than or equal to 1 diopter per year. Onset often begins during school years and may progress until the late 20s or early 30s. Outcome: can develop into high myopia if uncontrolled. 4. Degenerative pathological myopia. Definition: severe form of myopia with structural changes inside the eye. Findings: macular atrophy, retinal tears, choroidal neovascularization, abnormal blood vessel growth. Nature: often hereditary or rapidly progressive from childhood. Causes of myopia etiology. 1. Anatomical factors. Increased axial length of the eye, the most common cause. Normal adult eye length, approximately 23 to 24 millimeters. Myopic eye, often 25 millimeters. Excessive curvature of the cornea or lens increases refractive power, focusing light in front of the retina. 2. Genetic factors. Children with 2 myopic parents have a 60 to 80% risk of developing myopia. Genes such as POX6 and COL1A1 influence eye tissue development and structural integrity. 3. Environmental and lifestyle factors. Excessive near work, prolonged reading, smartphone, tablet, or computer use causes sustained accommodative strain. Lack of outdoor activity. Insufficient natural light reduces dopamine production in the retina, a key factor in controlling eye growth. Poor lighting conditions, reading or working in dim light increases visual strain. 4. Biomechanical changes. Axial elongation leads to thinning of the sclera, the white part of the eye. Altered collagen fiber structure in the sclera makes the eye more susceptible to further elongation, a cycle that drives progressive myopia. Main symptoms of myopia. 1. Blurred distance vision, the hallmark symptom of myopia, because light rays focus in front of the retina. Distant objects appear blurry and indistinct. 2. Squinting. People often narrow their eyes to reduce the size of the pupil pinhole effect, which temporarily improves clarity. 3. Eye strain asthenopia. Prolonged focusing on distant objects can cause discomfort, heaviness of the eyelids, and fatigue. 4. Frequent headaches. Visual strain from attempting to see clearly can cause frontal or forehead headaches. 5. Specific signs in children. Difficulty seeing the classroom board clearly. Holding books, phones, or tablets very close to the eyes. Sitting very close to the television. Rubbing eyes or frequent squinting. Risk factors for developing myopia. 1. Genetic factors. Having myopic parents significantly increases risk. Both parents myopic, approximately 60 to 80% risk. One parent myopic, approximately 30 to 40% risk. Multiple gene mutations, for example, POX6, COL1A1 affect ocular tissue development and structure. 2. Age. Typically develops between ages 6 and 14. Progression is faster during school years due to increased near work. 3. Prolonged near work. Activities like reading, computer use, smartphones, and tablets. Excessive accommodation strain may contribute to elongation of the eyeball. 4. Limited outdoor time. Natural sunlight exposure stimulates dopamine production in the retina. Dopamine acts to slow excessive axial elongation of the eye. Children spending less than 2 hours outdoors daily have a higher risk of developing myopia. 5. Poor lighting conditions. Reading or working in dim light increases visual strain. Insufficient intensity or spectrum of artificial lighting can exacerbate eye fatigue. 6. Ethnic predisposition. High prevalence in East Asian populations, China, Japan, South Korea, with rates up to 80 to 90%. Likely related to genetic predisposition and intensive educational demands. Complications of myopia. 1. Retinal detachment. In high myopia, elongation of the eyeball causes stretching and thinning of the retina. This increases the risk of retinal tears and detachment, which can lead to sudden and severe vision loss. 2. Glaucoma. Elevated intraocular pressure is more common in myopic eyes. Damage to the optic nerve may occur, resulting in narrowing of the visual field. 3. Myopic maculopathy. Degenerative changes occur in the macula central retina. This leads to decreased central vision, making tasks like reading or recognizing faces difficult. 4. Vitreous hemorrhage. Abnormal new blood vessels near the retina can rupture, causing bleeding inside the eye. This results in sudden visual deterioration. The diagnosis of myopia. 1. Autorefractometry. Quick and accurate measurement of the eye's refractive error. 2. Retinoscopy. Manual assessment of refractive status using a light source by an eye specialist. 3. Fundoscopy. Examination of the retina, optic nerve, and blood vessels. Essential for detecting retinal tears or macular changes. 4. Tonometry. Measurement of intraocular pressure to assess glaucoma risk. 5. Axial length measurement. Ultrasonography or optical coherence. Tomography to measure the eyeball's length. Treatment of myopia. 1. Optical correction. Eyeglasses, safest and most widely used method. Contact lenses, convenient for active lifestyles but require careful hygiene. 2. Refractive surgery. Procedures such as LASIK, PRK, and SMILE reshape the cornea to correct focus. Recommended for suitable candidates with stable vision and good eye health. 3. Myopia control. Low-dose atropine. 0.01% eye drops. Effective in slowing axial elongation. Orthokeratology Ortho-K lenses. Worn overnight to temporarily reshape the cornea and improve daytime vision. Increased outdoor activity in natural light exposure helps regulate eye growth. 4. Treatment of complications. Retinal detachment requires urgent surgical intervention, for example, vitrectomy, laser photocoagulation. Glaucoma management includes pressure-lowering medications or surgery. Myopic maculopathy may be treated with intravitreal injections or laser therapy. Prevention of myopia. 1. Follow the 20-20-20 rule. Every 20 minutes of near work, look at something 20 feet, 6 meters away for at least 20 seconds. This reduces accommodative strain and relaxes the eye muscles. 2. Spend adequate time outdoors, at least 2 hours daily in natural light. Exposure to sunlight stimulates retinal dopamine release, which slows axial elongation of the eye. 3. Optimize lighting conditions. Ensure sufficient ambient lighting during reading or screen use to minimize eye strain. Avoid dim or overly harsh lighting. 4. Regular eye examinations. Early detection through periodic checkups, especially in children and adolescents. Timely correction prevents progression and complications. 5. Limit prolonged near work. Encourage breaks during extended reading or digital device use. Promote varied visual activities that involve looking at different distances. Conclusion: myopia is a prevalent refractive disorder with multifactorial causes including genetic, predisposition, and environmental influences. Left unchecked, it can progress to high myopia, predisposing individuals to serious ocular complications such as retinal detachment, glaucoma, and myopic maculopathy. Effective management hinges on early diagnosis, appropriate optical correction, and proactive myopia control strategies including low-dose atropine, orthokeratology, and lifestyle modifications like increased outdoor activity. Preventive measures focusing on reducing visual strain and optimizing visual environments are paramount in curbing the rising global prevalence of myopia, particularly among children and adolescents. Preserving visual health demands a comprehensive approach combining medical intervention, patient education, and societal awareness to ensure quality of life and reduce vision-related morbidity. Your vision is invaluable. Protecting it today safeguards your world tomorrow. Asterisk, thank you all for watching and taking the time to learn about myopia and how to protect your precious vision. Remember, your eyes are the windows to your world. Take care of them with daily habits and regular checkups. If you found this video helpful, please give it a thumbs up and share it with your friends and family who might benefit from this information. Don't forget to subscribe to the channel for more valuable health tips. Stay curious, stay healthy, and keep your vision clear. Together, we can prevent vision loss and live life in full focus. See you in the next video. Asterisk.